Hi everyone, my name is Chan. I'm one of the junior doctor working in the NHS Highlands. Welcome everyone to today's video presentation of wound healing. We will use the next few minutes or so to explore the essential points and processes involved in the process of wound healing. This is often a popular topic in the MRCS exam. Let's get right into it. In today's presentation, we'll mainly be covering the definition, the classifications, stages, and factors affecting the process of wound healing. First of all, we have to understand that wound healing is a long process which involves the restoration of tissue structure and function. These are mainly involved in the restitution of tissue integrity and tensile strength, respectively. I would personally classify wound healing into primary, secondary, and tertiary intention, aka delayed primary closure. In primary intention, where wounding has occurred and the wound is closed by direct suturing. Now, let's look at secondary intention. Again, as you can see in this diagram, in secondary intention, the wound base is wider and the wound is allowed to heal from beneath the base by the formation of granulation tissue, and then the epithelium grows over time with the formation of the scar. One very good example would be the incision and drainage of an abscess, whereby the wound is packed with gauze to be left open after the drainage to allow secondary intention to take place. Now let us then look at tertiary intention or delayed primary closure. It is a combination of secondary and primary intention, whereby the wounding has occurred and the wound is left open to ensure there is no evidence of infection or presence of any foreign bodies, and allow granulation tissue to form as well. Then over time, the wound is then closed with a suturing and the scar formation over time. We then now move on to the different phases of wound healing. It first started off with hemostasis, then acute inflammation, formation of new blood vessels, with the formation of granulation tissue, epithelialization, plus wound contracture, and lastly, maturation and remodeling. Within seconds or minutes after wounding has occurred, with the involvement of red blood cells and platelets. There are three main phenomena that happens during the phase of hemostasis. They are mainly vasospasm, platelet plaque formation, and the generation of a fibrin-rich clot. Acute inflammation takes place within days after hemostasis has occurred. Neutrophils, fibroblasts, and macrophages are the key cells that are involved in this process. The main phenomena that could observe in the phase of acute inflammations are migration of neutrophils into the wound, the release of vascular-derived endothelial growth factor, macrophages and fibroblasts form a couple matrix to substitute the clot which has first formed in the stage of hemostasis. Next up is a process of angiogenesis promoted by vascular-derived endothelial growth factor, which is by the endothelial cells. In the phase of angiogenesis, there is an organization of microvascular network. The granulation tissue is formed from a complex of endothelial cells, fibroblasts, and macrophages. The key features of the granulation tissue is that it is highly vascularized and has the shiny red and granular appearance when looked in the naked eye. Now we are at the final phase of wound healing. The remodeling phase is the longest phase of all. In this phase, we can notice that fibroblasts has differentiated into myofibroblasts to help facilitate in the process of wound contraction. Remodeling also takes place by the formation of collagen fibers, and the pale scar can be noticed in the remodeling phase, which is due to the regression of the microvessels. We then now move on to the different factors that could affect the process of wound healing. Personally, I would like to divide into local versus general factors. In the case of local factors, as we could see here, poor blood supply, presence of hematoma, infection, foreign bodies are the few main local factors which could affect wound healing. Poor surgical technique is also one of the causes that could delay wound healing. Problems like excessive wound suture tension or even the wrong choice of suture material can negatively affect the local blood supply of the wound, hence delay wound healing. And lastly, there's the presence of radiotherapy, which increases the risks of wound adhesion and breakdown. On the other hand, general factors are mainly involved with the body's systemic issues such as diabetes, immunodeficiency, malnutrition, and even immunosuppressant therapy like long-term steroid use. Other general problems like multiple organ failure, hypoxia, and the presence of malignancy can negatively impact wound healing at the level of cellular respiration as well as cellular metabolism. In hypertrophic scarring, the scar is often confined to the wound margins and can be often seen on the flexor surfaces and skin creases. However, in the case of keloid scarring, the formation of keloid tissues extends beyond the wound margin. Few of the common locations, such as the earlobe, chin, neck, shoulder, chest, as well as the deltoid region. It mainly occurs after an initial trauma or presence of the wound. One of the common treatments includes intralesional steroid injection.